There really is a need for something that's efficacious, that's easily accessible to really target anxiety, depression, improving sleep, and also improving pain tolerance.
So in 1992, I had to make a split-second decision of head-on collision next to a petrol truck or drive off a bridge. That was in the Yemen near the capital Sana'a, hence the company name. 60 foot down into a dry riverbed, I got a spinal injury and a traumatic brain injury. And both of those resulted in a nerve damage pain problem that was so severe I was given a 5-year life expectancy. So in hospital, I watched a movie. And that movie was alternately good and bad from my perspective the whole way through the movie. And that flipped me in and out of what we would now call a flow state. So the origin of this device is me trying to figure out how can I create that flow state on a reliable, repeatable basis without having to find another film. So I made the first device and it turned out it actually solved the entire pain problem because it generated enough neuroplasticity. So the Sana device is a new tool in the toolkit of mental health professionals. What it is an audio-visual neuromodulation. So someone puts it on, turns it on, and they're getting pulses of light through closed eyes and pulses of sound, and that's then generating essentially a relaxation effect on demand. We are collecting heart rate variability on the forehead in this version of the device. In the next version of the device later this year, that data will then become a full closed loop feedback system, which means anytime someone puts the device on, it will be measuring how they're responding to each of the sub-algorithms and then prioritizing in real time the treatment that is actually being most effective on that individual in real time. So the very first time someone uses it, they put it on, turn it on, it's quite an intense and powerful experience the first time because the device is actually recreating what's called hemispheric balance, which is the two hemispheres of the brain producing activity at roughly the same amount on each side of the brain. So that very first experience can feel like, wow, this is intense. Usually by the 6th or 7th minute, someone's already even in that first experience in a very relaxed state. Most people are asleep by the 16th minute if they are lying down when they use it. If you're going to lie down and you've got an anxiety issue or a depression issue or a PTSD issue, this device will get you to sleep faster. And then what we usually tell people is then use it during the day whenever any of your symptoms are too much for you to be able to do what you want to do with your day. So the studies that we are underway at the moment are fibromyalgia at Duke, neuropathic pain at Mount Sinai, PTSD that we're starting at MUSC, and an anxiety pivotal study as well. The aim for Sana is to be on market for anxiety, depression, PTSD by the end of 2023. For the PTSD study, we are recruiting people who are within the Medical University of South Carolina health system. For the anxiety study, we have a broader remit to recruit anybody from anywhere we want to at all. We are doing a prioritized focus on mental health and physical health professionals. Our aim is, can we go out and help the helpers? Because that way we have an increased leverage on helping more people.
Project that I'm involved with as a principal investigator is what's called the MIGHTY study, which is one of the largest studies looking at the use of the device in a population of patients with fibromyalgia. The preliminary data, again, is very impressive in showing significant improvement in depression, anxiety, sleep quality, and pain. And it's one of the largest trials that I know of in this patient population.
Because this is such an easy, low-risk tool, we're hoping to ease that burden on mental health professionals by allowing them to get relief to people on their waiting lists before they even come through the door.
Biggest perk is probably just there's no risk in it. And dealing with fibromyalgia, you deal with fibro fog and all these other things that the pain and everything's grabbing at your attention, so much so to the point where it's almost impossible to have a normal conversation. And the Sana device has helped me reduce my anxiety. It's helped me be able to actually go and seek social life.
I really believe that this is a prime time to really develop market technologies that are well vetted, that are efficacious with minimal adverse effects or side effects. The need is great and the options are limited.
Typically with the psychiatric drugs, they're not PRN. They have to be done on a very strict schedule, and people should not deviate on those schedules without their physician's input. Whereas this device, someone can use multiple times a day if they're having a bad day, or not at all if they're having a great day. They can choose how to use it. And that giving people more control and more agency over their treatment is a very large part of why the device is so powerful.
My anxiety has dropped almost 90%, I'd say. I used to be prescribed Xanax monthly, and I think I've had my last 2 containers of Xanax for the last 6 months.
That's one of the things that attracted me to Sana, was the fact that we were actually developing a device that would help a broad variety of indications, both mental health as well as a sort of the pain side of things, pain management. It basically takes your mind into a state where your rational part can actually counteract a lot of the feedback loop that causes the anxiety and depression. A lot of times for me, when I can't go to sleep, it's because I'm constantly thinking about something, and then you get into a rut, into a loop, and this helps break that loop.
I usually don't get involved with industry, but I really believe in the Sana project. I spent a lot of time vetting it, and I believe it's something that patients can find incredibly effective, and again, minimal side effects.
This really is personalized medicine that we are making, which will be improving for each person with every single use.